If you actually say turbo cancer without clearly qualifying what you mean, it will immediately be classed as misinformation. That's because in reality, there is no formal definition of turbo cancer. So if you went to your doctor and said turbo cancer, it would immediately be rubbish. There is no such thing. But call it what you may, whether it's turbo cancer, rapid cancer, fast onset cancer, there is something that is occurring that is very, very unusual and needs to be addressed. That's really the question. Now, I don't know what you are seeing depending on where you are in the world, but at the moment, we are seeing lots of presentations with regards to new newspaper story. So this was one on the 18th of October, where the coroner warns people who develop one small symptom to see their doctor urgently because they might have cancer. And this was from a senior coroner in Manchester because of the hoarse voice. And they were making it specifically in relation to the death of Stephen Stringer, 74-year-old singer. And what you have to notice is that it is critical that when they looked at the inquest, the nature of his symptoms and the deterioration, the important thing that came up from that was the fact that by the time it was diagnosed, it was in stage 4. And I think it was a little later on in here. It was in January 2024, almost a year after his vocal cords started to sound strained, he was formally diagnosed with stage 4 squamous cell carcinoma of the glottis. So, one of the issues is that in trying to understand what exactly is happening, you have to understand what they mean when they say stage 4. And I've put together a few slides from a presentation. I did this presentation some time ago, but it is so valuable that I think that I'm highlighting that it's in the description, where I predicted that we're going to see a cancer explosion. So it's a full course, and in it, we have a question and answer sessions. We do an overview of cancer, immunity, the basics of immunity, IgG4, interference suppression, spike protein, and P53. A lot of points that are covered in it. So if you want the more detailed presentation as to what I was doing, you can look at that link there to have a better understanding of it. However, one of the things that I think is very important is to clarify what we talk about from the perspective of the stage 4 cancer. So, what normally happens with cancer, and you can see here, this is just like a skin cancer. So the lump is visible on the surface. There is some spread of the cancer cells, like almost like the roots going down. They're then going to be in contact with the lymphatic vessels. And so normally what happens is that this cancer will spread from the local invasion here into the lymphatic vessels. And then beyond that, it will then spread to the rest of the body. Now, it's important to note when we usually speak of stage 4 cancer, we're talking about advanced or metastatic cancer. That means it has already spread. Here is the problem. Call it what you will. It seems that more and more people are appearing with stage 4 cancer as their first presentation. So let me repeat that. Normally, a cancer will grow locally, whether it's in the colon, whether it's in the lung, then it will spread to the lymphatic vessels, and then it can be picked up maybe on PET scans. Person may have some symptoms or even a routine check. And then, if it's still not picked up in another year, 18 months, it can spread to different organs. So it could spread to the liver, to the brain, to the lungs, if it was in the colon, wherever it is. And that's the advanced stage cancer. That trajectory normally takes a good period of time. What is happening now is that people on their first presentation are being seen by the doctor with stage 4 cancer. Now, that is very different. And that's where this concept of turbo cancer came from. because it is so aggressive and it is presenting so quickly that we've not seen this kind of presentation before. I think that it's important to recognize that cancer usually is fundamentally about failure of the immune system. And there's a slide that I tend to use that I've used in the presentation here, and I'll just show the full screen of it. And this slide here is talking about that you have multiple levels of protection, the general health, whether or not you're exposed to toxins, whether or not you have genetic predispositions. And then the final one is your immune system, because the immune system normally kills cancer cells. So all of these layers have to fail before somebody will get cancer. And the point that seems to be occurring here is that this immune layer that is exceptionally important, meaning that even if you had the genetics, toxins, general health was poor, a reasonable immune system can protect you at least for a period of time. But what seems to be happening now is that if you remove this immune system, suddenly the risk, the predispositions are suddenly very, very significant. And that's the piece of the puzzle that seems to be relevant with regards to this concept of turbo cancer, or call it rapid progressive cancer. You can call it, I'm coming up with names here. It doesn't matter what you call it. The point is that it is presenting not so much in the context of that it is presenting with rapid growth, but it is metastatic spread in an early fashion. That's really, really where the difference is. And I'm trying to think of a good analogy that will be able to explain what is that would describe that. And so when I think about it, I reflect on the fact that it probably is coming down to an immune system failure. And I'm going to show a slide here that again I from the presentation, and the link is in the description. But in this slide here, we have this situation where what is highlighted that many of the characteristics of cells, so these cells that normally kill tumors, have been damaged. This is the natural killer cell. These particular macrophages are not functioning as well. These lymphocytes are not functioning as well. And so they are inhibited with their ability to protect against cancer. And additionally, you have another set of cells that, especially macrophages, that tend to be involved in the spread of cancer, where they almost can augment the spread of cancer, where it appears in a metastatic fashion. So this is the kind of presentation that I think is extremely concerning and does need to be addressed. The question is that at the moment, because there is the potential, and I cover that in the presentation, I can't talk about it here, but I make it clear that I am concerned that there are certain specific factors that can occur with the elephant. And that elephant in the room potentially can exacerbate the issues. Now, there are only a couple of things that could explain why this is occurring at this time. And so we have to reflect on that. And it is a real possibility because when I this data was there and then it disappeared. They changed the way they counted it. So if you don't see it in my presentation, you'll not be able to see it. But what I did is that I went through the time frame looking at a period of 2020, 2021, 2022, 2023, and looking at the months of the year. And essentially, what I was doing was not when people died of cancer, but when they got their first treatment, because I realized that this is when you will be able to identify if cancer is spreading more frequently in the population. And so you can see that in 2023, in almost every month, it was higher, way higher than 2020. So this trajectory seems to be related to the pandemic. Whilst there may be some degree of potential connection with COVID, the infection, my concern is that there seem to be far more points that are leading to the elephant in the room. I say it very carefully because we don't know for certain. But what doesn't seem to be happening is that there doesn't seem to be an interest in trying to understand these characteristics with regards to advanced presentation and the links. Nobody wants to look at that, it seems, but it is an exceptionally important question. Because fundamentally, if we are getting patients presenting with stage 4 cancer, this is where it has already spread before we've had a chance to do any intervention. It means that surgery is out of the option, or the not out of the option, but it's less likely to be beneficial because you are immediately shifting to a palliative approach with that patient. Because no matter what you do, unless it's a cancer that is very responsive to radiotherapy or chemotherapy, the reality is that you can slow the growth, but you can't actually get rid of the cancer. So it's a palliative approach. In the past, if you think about, say, for instance, breast cancer, if somebody had a lump in their breast, or even if it was a good size nodule there, even if it had spread to the lymph nodes, you can remove the breast, you can take out the lymph nodes, you can do chemotherapy to protect against just in case there was any advanced spread, and that patient can be cured. However, if on first presentation, this has already spread to the liver, to the lungs, to the brain, even though you may use chemotherapy in some cases, you will be limited by the fact that you may not be able to cure it because you can't use surgery. And the kind of chemotherapy or radiotherapy you may have to use may be so toxic to the body that it causes more side effects than benefits. So it very significantly complicates the management of these patients. We definitely need answers. And as I said, I've been calling over and over again that specific assessment of histology, especially with these. Now, almost every cancer is looked at histologically. So it is studied. And so, therefore, there is the possibility of using specific stains that have been developed by Professor Arnie Burkhardt. Sadly, he has passed away. But the principle remains that in theory, his stains are able to differentiate the source of spike protein. And so we could actually assess that relatively definitively to see if there are any patterns. The problem is that there doesn't seem to be an interest in looking at that in any great detail. So, in summary, just remember when you're speaking about this, if you do say the word turbo cancer, anybody who doesn't believe or doesn't want to question the narrative will immediately discount it. So you have to qualify it with saying, I understand that turbo cancer is not a formal diagnosis. It is just a word that is made up to describe the changes that many people are observing, that people are presenting, and it's not rapid cancer. This is part of the problem with the word turbo. It's giving the impression that the cancer is growing fast. It's not necessarily that it is growing fast, it is just that it is spreading rapidly from an early stage and disseminating in the body in a way that it doesn't normally do. And so, if you qualify that, it's very hard for somebody to discount it. And you therefore are raising the question that, believe me, everybody is seeing, they're reflecting on it quietly, but they don't know what the cause is. Again, you can't specify the cause. Whatever you do, you can make reference to the fact that at this stage in the pandemic, there are two big options. It could be infection or it could be otherwise. But until this is studied in detail, we will not know. But here's the reality: if it is connected to that elephant in the room, and I usually like to show the elephant because I think that people tend to grasp what I mean when I show this elephant in the room. But this is what it looks like. It's sitting there. Nobody quite knows what's going on. Everybody's baffled. They can't notice that the couch is squeezing down and there is a huge elephant in the room. And this is where we are at the moment. But what it requires is that it requires us to therefore push those people who are involved at the front. So, meaning that those specialists who are definitely involved in this process, we've got to keep asking them. We've got to push them that in their meetings when they meet with the pathologists and so on, they should be asking that question: Is it possible to stain it and to see whether or not there is any evidence that could explain if this is in any way connected with spike protein? These are the kinds of answers that we need urgently. It may not necessarily give us an answer for how to address it, but it's a huge step with regards to us finding potential solutions to mitigate it. The reality is that if this is as serious as it seems to be, and we make no attempts to mitigate it, the implications at a population level will be horrendous. So, if you want to see more about this point with regards to what I had done with regards to that presentation, remember to look in the description below and you will see the links to what I anticipated would happen. I looked again at all the different characteristics, basically from the immune point of view, IgG4, interferon suppression, the fact that there may be contaminants in it, and all of these things together can be all contributory to breaking through any individual's protection against that horrific thing that we have facing the world, which is cancer. Have a great evening.